welcome to Tech Talks, the People and Planet podcast. On this episode, I am joined by Ari Brenner, the founder of In-House Health. Ari, hi. How's it going?
Hey, Lee. Thanks for having me.
Thank you for joining us today. So, Ari, your business, this is all about AI-driven scheduling and management, isn't it? It's for nursing teams in particular. Tell us more.
So the core of what our company does is try to solve, I think, one of a couple key drivers of instability in the way nursing kind of runs in general, and the scheduling and staffing part of it in particular. It's a very complicated system. There are a lot of pieces of it that are more, on the system itself, management, process to address, but there are a couple pieces that we on the founding team, I'm a team of 3 founders, myself, having previously founded a digital health unicorn called Stellar Health, one of my partners being our chief nursing officer, who was a bedside nurse in a nurse surgical ICU for about 10 years, moved to informatics, and then a technical co-founder who's best of the best algorithm developer from military intelligence and from Google. So the 3 of us, as we kind of looked at the problem space in nursing, which is just a worsening problem, across the world, we said one of the key things that prevents nursing teams from staffing themselves effectively and sustainably is predicting the demand for their services. And predicting demand for services is a problem that every industry faces, but I would argue that it's particularly acute in healthcare. To put it even more bluntly, it's a lot worse if I get my demand prediction wrong in healthcare than most industries. If I predict wrong how many patients I'm going to have or how sick they're going to be in a hospital setting, which is one of the most acute settings out there, lives are at stake. And so a lot of what makes nursing a very challenging thing to staff and schedule, why it's so demanding on nursing teams, is because the stakes of getting it wrong are very, very serious. And so nurses are asked to be on demand, to pick up shifts with little notice. And the system is very sensitive. Anybody who has a nurse in their lives can pretty quickly tell you a story of the shift that went so wrong simply because somebody got a flat tire or any other disruption that then kind of snowballed and created all these problems. So at the core of the company, we predict and present in a very easy to understand way for the people who are managing nursing teams and their schedules, the demand for their services.
Nice, like it. And it's not just a US problem, is it? I'm based in the UK, as you know, and we have a whole host of problems with our healthcare system, as well as I'm sure many countries around the world do as well. And I speak to lots of people within the healthcare professions, and it works both sides, doesn't it? This is solving problems for the patients, but it's also solving a problem for the healthcare professional themselves, in that burnt out, stressed. Here in the UK, we just announced that junior doctors are on strike, midwives are on strike, even consultants. So I think this sort of platform really helps with that side of things as well, right?
Agreed. And I think a lot of the kind of underlying drivers and trends that we see in the US system are common to the UK and the NHS. I think locum is a big kind of source of both sometimes a solution to the problem, but also a lot of instability with workers kind of moving in and out of geographies and out of systems. As far as my understanding goes, these are pretty universal problems particular to nursing. And I think there are a few pieces of it that are particularly targeted at the U.S. system, like how the U.S. system attempts to measure productivity, some of the regulations that hospitals in the U.S. are subject to. But other than that, this is a very generalized problem that I think hospitals around the world are facing, particularly their workforces right now.
Yeah, for sure. So how does the product work then? Mobile app maybe, is it? Or a web app?
Web app and a mobile app. So the core of it is what the person doing the staffing and the scheduling uses. So typically that's the unit manager. So, hospitals are organized by kind of floors or units. So, you have a cardiology floor and unit that has a nurse manager. This is usually somebody who was a nurse themselves, practicing nurse on that floor. They, of course, still are a nurse, but now they moved almost exclusively into the management, though it'll vary by hospital. Sometimes they are on the floor, but usually it's an administrative role, and they're accountable for the well-being of their team, for the productivity of their team, and for the outcomes of the patients managed by their team. And so we give them an app that combines the clinical insights, so what the needs of the patients they manage are along with the team insights, so how their team has already been scheduled and what the potential needed or kind of opportunity changes are. That then flows into interactions and prompts with their team. So as they make changes, request changes, or they evaluate how they want to structure the team in kind of the coming weeks and months, it automatically makes pings and kind of adjudicates the needs. And then also into some other tools for the hospital, like management dashboards, things that allow the, what's called the house supervisor, the person coordinating all of the units at the same time, allows them to see, which units are in trouble, which units are doing well. And sometimes they're like shared resources that they're doing. So it's kind of a command center that starts with the nurse manager, then extends up to hospital-wide management, and then kind of quote down to the bedside nurse and their schedule and their patient assignments.
Interesting. Where does the AI fit into it?
The AI is in particular to the schedule building and updating part. So I'd say really the number one core thing and like the most kind of sophisticated analytics of the platform is the demand prediction. So you can imagine hospitals have a ton of things going on. It is a very non-trivial problem to say, how many nurses are we going to need on this floor on Thursday? And so that's where the machine learning has been applied, that we've fed it millions of patient cases and millions of trajectories through hospitals. And so now it has a pattern recognition that says, well, if this is what the floor looks like on Monday, and this is all the other input data that I have, I'm going to make a prediction of what we need on Thursday. And like in the classical learning model, the model every time it predicts correctly, you give it a reward, you give it a carrot. Every time it gets incorrect, you hit it with a stick, and then it gets better and better and better over time, and is able to predict those future shifts. Some other applications of the company's machine learning are to the shift quality themselves. So balance around types of staff and the fairness of shifts. And again, that's just a machine learning problem of you fed it, different permutations, different types of shifts. It says, I think this is the best shift. If it kind of gets it right by the logic and rules, then you give it a carrot. If it gets it wrong, you hit it with a stick until it's building more and more effective and productive shifts into the future, which is the hard part.
Yeah, perfect. So you mentioned before about Stellar Health. What's your background? How did you arrive here in House Health?
Yeah, so I'm a lifer in healthcare at this point, and essentially have spent all of my recent time over the last decade in healthcare transformation, innovation through tech. So Stellar, I founded in 2018 around a couple co-founders in New York, and that company is a workflow platform for primary care. So you see the kind of the commonality here. I've moved from primary care, which is a clinic setting, to acute care and nursing management. But the common elements are it is a very, very specific kind of problem where understanding this user and their use case, how they spend each day, from when they walk into work in the morning to when they leave at the end of the day, like how they're spending their time, where we fit in, and basically prompting them to change behavior in non-disruptive but helpful ways. So I developed that product. It's very successful. It's used by now more than 5,000 doctors across the U.S. We're in majority of states. That company serves all of the largest insurance companies, United Healthcare, Humana, Aetna, and a bunch of large systems as well, healthcare systems, partnerships with that company. And so I've kind of built out provider tech at scale from that individual user understanding up to the kind of system-wide transformation we're trying to get with that specific prompt, that specific workflow.
Got it. Okay. So you've been in this industry all your career. What challenges have you had over that time? How have you got over those as well?
Yeah, I have no other marketable skills pretty much except for my passion for specifically healthcare and addressing it through provider tech. It's kind of my niche. It's what I like to do. And I think, like many founders, it's the specific mix of things that I am. I'm very product focused, so I really understand each touch that a user has in our product and why it's helpful or why it's not. I'm a system thinker, so I understand why we get bought, what the impact and the KPIs that our customers want to see, which, hospitals are looking for money, right? They're looking for the financial impact of our product. And so being able to quantify that very specifically, show the ROI, to them in real time, which is what makes us grow and scale within customers and across customers. And a lot of these skills that I'm setting, Lee, are targeted at the challenges of building in healthcare. I think, you can have something that's a smart product, but doesn't drive ROI clearly. You can have a really good use case, but the product doesn't get adoption. So, solving all of these kind of factors in a system, in a product that's purpose built for showing ROI, for resonating with users and buyers, is kind of where I focus and try to excel.
Got it. What comes next for in-house health then? Anything that you can share with the listeners?
Yeah, I mean, to no surprise, and certainly not to you, somebody who speaks with, founders kind of day in, day out, there's a much bigger vision here. I talk about what we deliver on the day to day, and I think, delivering a small thing of value within the healthcare system is exciting enough. And I spend most of my time thinking about that and how to make sure we succeed at that. But the broader vision here is that there is a bigger transformation worldwide that's come to the way we work, and nursing in particular, right? And nursing is lagging. Most of us are used to flexible schedules, and over the last 5 years, we've kind of been accustomed to having more and more control over our personal lives vis-a-vis our professional lives. And I think nursing has kind of lagged to that. I mentioned locum earlier. I think locum, both in the UK and the US, is a big response to that. It kind of gives some power to nurses, allows them to define their schedules, but also takes away a bunch of stability and benefits and things that you get with a consistent employer. So our vision is to build a suite of products, a workforce operating system that allows nurses to have flexibility, control, and within the context of a steady employer, because we think that a big issue for quality is that the current system is burning people out and causing them to jump between jobs trying to look for something sustainable. So we're trying to basically set it up so that hospitals can create that experience for their staff, retain them, and then therefore deliver a higher quality of care at a lower cost. So tools that kind of go behind that are, for example, using our workload prediction engine to allow hospitals to do on-demand staffing within their four walls. So to say, hey, I need to, I have definitively that I need to fill an extra shift on Thursday morning on this floor. Who from my own pool can pick up this shift, and what should we pay them? And do that all at the press of a button, instead of what happens right now is usually somebody gets on the phone with an expensive locum agency, and the shift fill comes from there. It's somebody external. It can be the right model. I'm not saying it never is, but I think more and more the hospital controlling it and delivering those opportunities to their own folks first and foremost is a part of the puzzle. So we're developing an operating system to allow hospitals to do that. That's a big focus for us over the next 6 to 12 months.
That's really interesting. And as someone who's been in the recruitment industry all my career, I can totally see how that would work. Ari, thank you so much for joining us. It's been really interesting. It's all we've got time for, but yeah, thanks very much. Guys, this has been Ari Brenner from In-House Health.
Thanks, Lee.